Now I want to share with you about a special patient. Her name is Piedad, and Piedad is from Colombia, and we first came to know about Piedad from a gentleman who showed up at the clinic with pictures of Piedad. And this is what she looked like when we first met her. Piedad has a condition known as congenital lymphedema. And for those of you who aren't medical, lymph is kind of a water-like substance in our body, and it eventually finds its way back to the veins. But she has a problem with those lymph channels, and so she ends up with kind of a bottleneck situation where all this fluid gets trapped in her legs and can't find its way back to the veins. So we wanted to help this woman, and of course, being a surgeon, my first thoughts turned to surgery. But none of the options that are available for this disease process, none of them work. They don't get good results. And so the only intelligent thing I did really in taking care of this woman was send pictures of her home to my family. And my twin sister is a physical therapist. And she had just recently done some specialized training in the treatment of lymphedema. And so she said to me, don't you think it would be a good idea to offer these treatments to Piedad? And I thought it was a great idea, but as you have seen from some of these pictures, San Lorenzo is not exactly at the height of medical technology and sophistication, and so certainly those techniques are not available to us there. And so I told Susan that the only way this woman was going to get these treatments was if she came down and did it herself. And so she did. Susan's been down to visit us twice to take care of Piedad, and this is what she looked like on the first day of her treatment. And just, if you can, I don't know if you can see her face very well, but just notice her face. The treatments are a combination of specialized massage techniques and the application of compression dressings. And so this is Susan doing the massage techniques. And this is when they started to wrap. You can see when they started, Susan could barely get her arms around one of her legs. Her legs are so big. And they started with one leg, and once she started to get improvement on one leg, they started treating both legs. And normally, well, this is Piedad with both legs dressed. Normally, these patients see a therapist every day because it's fairly complex. But of course, Susan was only going to be with us a short time. And so basically from the beginning, she started teaching Piedad how to do this herself. And Piedad's very motivated. And she really picked up on it pretty quickly. I mean, look at this. She basically bends herself in half and to get all these dressings on. A daily weigh-in was part of the routine. When Piedad came to us, she weighed more than 300 pounds. And she's a small woman, I don't know, similar to my frame. But she weighed more than 300 pounds when she came to us, and she now weighs less than 200. So she's lost over 100 pounds. This is a Weaver Twin Brain Trust, trying to figure out what to do with the wound she had on her leg. And that's Susan with Piedad and her mother, who also came at the beginning to help Piedad with her treatments. This is Piedad 1 month to the day after she started her treatments. And look, I don't know if you can see her face. I mean, she's just a completely different person. And this is several weeks later. So Piedad she's now living in San Lorenzo, and she's not an official employee of the clinic, but she's become part of the family. And she helps us out on surgery weeks. She helps us with our dirty laundry, and actually she'll do anything that needs to be done. She's a really sweet young woman. And her thighs look great. There's still a little work that needs to be done on her lower legs, but she's really gotten about all she can out of doing the dressings herself. And so we're trying to help Piedad get a visa to see if she can't come up. Susan lives in Florida, to see if she can't come up to Florida and get some personal intensive attention to finish the treatment to her legs, to the lower part of her legs. That's all I have for you. I just want to show you, I have a few slides here at the end, they're kind of reminders of why we are where we are and why we do what we do. And I just want to reiterate what Damaris said. It's kind of humbling sometimes to realize how many people here support what we do there. We're only about, I don't know if we're 7 or 8 people, and all of you people who support us and pray for us and support us in so many ways. And they all know, all of our employees know how much you help us as well. They're very cognizant of that, and they pray for you as well. And I just really thank you so much, because we couldn't do what we do without you. So thank you very much.